So now it is a privilege to introduce Dr. Anne Gearity, who has a mental health practice and a long commitment to early childhood work. She was an original faculty member in the Infant and Early Childhood Mental Health Certificate Program at the University of Minnesota and is now in the Department of Psychiatry. Her manual, Developmental Repair, written in collaboration with Washburn Center for Children, focuses on young children experiencing difficulties with emotional and behavioral regulation. She has recently worked with the Mother-Baby program as part of the Red Leaf Center for Trauma, helping at Hennepin County Medical Center. So please join me, even though she can't hear it, join me in a warm welcome for Dr. Anne Gearity.
Thank you very much. I'm delighted to be here. Now let me get my, oh, wrong thing. I'm going to pull up my, this will just take me a minute because it has to go through. I'm really glad to be here. You know, the North Shore has always been very important to me, mostly because Lynn and her staff are so welcoming and have made me feel, oh, wrong one, have made me feel like I'm part of your community. Okay, here we go. Let's see if it works. So what I'm going to talk about today is COVID in the fall. It will still be here. And I think it's a good way to start with this confession because I suspect I'm not alone. When this happened back in March, I think many of us were shocked, but had a sense of we can do this. You know, we can do this. And we came home and we hunkered down and we learned how to do Zoom and we learned how to do other social media tools. And we thought, we'll do this for a couple of weeks or even a couple of months. And then it will be summer and then it will go away and maybe there'll be a little bit more, but it won't keep bothering us. Okay, Jan, we might need your help because this is, I don't know where it went. Let me try again. So it was just here and then it disappeared. So this process of there we go. So it didn't happen that way. And here we are trying to make sense of it. So what we're going to do today is think about where we've been, what we have learned, and what more we can know to help young children and families. So what we're going to look at today, oh, this is, maybe I'll make it work, is that we had initial responses that we learned from. And we did learn some things. In May, we had some ideas and we tried them out and we learned. Some children and families actually found their stride. And we saw that people really managed better than any of us thought we could. And that was very exciting. Jan, I think we need to go to you. Can we do that? Can you, yeah, go on, because it's not working. I can't figure out why. Okay, woo, 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 woo. Use this while we figure out our technology. You know, the trouble with PowerPoint is you put your brain in PowerPoint and then you think you can't know anything because it's all in the PowerPoint. So let's see if Jan can pull it up. Okay. Okay, so Jan, why don't you go to slide 3? Okay. So some children, some families and children found their stride, and we really want to admire our own resilience and confidence because we really did find our stride. The third thing we're going to talk about is anticipating this fall and really thinking about what the challenges are. Excuse me, I'm going to sneeze. And the fourth thing we want to talk about is how do we plan ahead for the long haul? Because it's going to stay around. Next slide. Okay, what seemed to help? So we want to revisit some useful ideas from when we first experienced COVID. And let's see what we can remember. Next slide. The first thing that we discovered is that it really helped young children and families and us to remember to blame this on COVID. You know, COVID is an experience that none of us had before. We're not prepared for it. But when we're having a hard time, it's really important to contextualize that hard time and make it about COVID. So children are tantruming and we say, oh, this is so hard. This is because of COVID. People or siblings are fighting and we say, look at us, we're all fighting. Boy, this COVID is making it really difficult. So we found it very helpful to blame it on COVID because it's true. COVID is changing things. The second thing we learned is that it's okay to be mad, but not to stay mad. We really had to understand that anger is a absolutely typical and healthy response, but to stay mad is to put ourselves in danger. We know that anger lasts very briefly in the brain, the energy of anger, and then it either dissipates or it accumulates grudges. And during COVID, when families have to so rely on one another, it's dangerous for parents to stay mad at children. It's dangerous for siblings to stay mad at each other because that disrupts safety. The third thing we realized is that we had to help children use company, but we also had to help children play alone, especially for families where people were trying to work. They had to really make an effort at giving their children not only permission, but almost encouragement and insistence that children learn how to play alone, because otherwise we couldn't survive. We recognized how developmental needs really influence coping, that for young children, staying at home was actually like winning the lottery. They like being with their parent. For school-age kids, it was really hard to miss their activities. And for adolescents, it was really hard to miss their future orientation, all those things they practice in the community. I have something stuck in my throat. I'll just take a sip of water. Oh, I'm sorry. I really had something stuck in my throat. Okay, I'm better now. So recognizing how development influences coping gave us some ideas of what we could do to help children. We know that we needed to support children's well-being as a pathway to children managing. If parents weren't okay, children weren't going to be okay. And we learned that reassuring children about danger and virus risks really brought down their anxiety. Next slide. Some children and families found their stride and some didn't. Next slide. One very important thing about COVID for young children is that our physical village got limited. You know, think of what you do with young children. You take them to Target, you take them to the grocery store, you take them to the bank, and that's part of their village, their social world. But our social village also got limited. We got wary of each other. Next slide. Because this is a community crisis, and this is important, families found ways to manage because everybody was in it. It wasn't a personal crisis that I had to solve alone or that I felt ashamed about. It was a community crisis. So we found that initially children stayed inside, but then playgrounds opened and families found a way to spend time together that was enjoyable. Families also adapted to work and parenting. They figured it out. Not great, but they did it. Online learning was not very helpful. There were some Zoom successes for young children. I watched one little kid do her Zoom dancing class and she was quite thrilled. But it wasn't very helpful for older children, especially when they had to do work. We know that we were hoping that children, especially under 10, seemed less at risk for COVID, and children started to play together carefully, and so that was helpful. And daycare centers for essential workers seemed to manage. Next slide. Now, this is the family response. We had steady families. You know, there would be bumps, but for the most part, they were steady. But we also had vulnerable families. And as you can see, the vulnerable families seemed to reach a peak of doing okay. And we all experienced that. And then they started to lose ground. Next slide. These vulnerable families that we all know about in our communities were struggling, but they were also managing because the stress was reduced. Child protection cases did not increase significantly as everyone feared, nor did hospitalizations. Now, those are starting to be on the rise again, but through the spring and summer, surprisingly, things were okay. Federal assistance and community support helped many families stay above water. And I saw in the chat room, there was something about money that was coming into St. Louis County. This has been invaluable for families to manage. Because if we remember Maslow's hierarchies, you know, it's very hard for families to manage each other's emotional needs when basic fear of survival is activated. Not attending school may have rescued stressed kids, many stressed kids, because for them, school was really hard. It actually reduced stress to not go to school. Mental health access increased because of telehealth. Cancellations and no-shows are way, way down in most people's practice. It's mental health became much more accessible because all you had to do was turn on your computer. Now, a qualification for people who didn't have access to Zoom or other media, it was harder. But the insurance companies even let us bill for telephone calls. So mental health care became more accessible. Children were seen in their home with their families. So real-time problems and real-time solutions were happening right in front of us, and we could really address them. But as the virus persisted, as did the fear and restrictions, families' resources started to be depleted. And I know I'm feeling this down here. My practice is getting harder. And I suspect that's the same for you. I think it's getting harder. Next slide. What we don't know. So next slide. So what do we not know? Will school and daycares open? What will the fall be like? So we know that stress during COVID is a multidimensional stress. We know the child is too sheltered. No matter what the child's age, there's too little stimulation coming in as we have expected children to need so that they can develop. We know that families are afraid and stressed. Lynn mentioned, should I send my child back to daycare? Should I keep him home? Will school be safe? Will school be open? Will school be closed? Will I lose my job if I can't if I can't send my children to daycare? All these uncertainties. Outside is kind of a question of where can we go? Where can we go for, relief? I'm still, when I talk to people, I visualize them in their workplaces. And then it has to dawn on me, oh, they're sitting in their bedroom or their living room or their dining room, just like me. So the outside has gotten really shrunk. And the world seems scary based on current realities, not just COVID, but certainly all the things that are happening in the world right now. It's a very unsettled and contentious time. Next slide. What people hope for is that we get lower COVID numbers, we'd be able to return to activities, and we get to security in a new normal. I think we all know we're not going back to exactly as it was in February, but we have some hope that we will get to a new normal. Next slide. What seems to be happening is that we did return to activities. Our COVID numbers have gone up, and we're facing a lot more shutdown and danger. Many of you are aware, there was just a story about St. Olaf in the paper today, that there was a party off campus and one student had COVID, and now many, many people are in isolation. Some students got suspended for the semester. This danger of wanting to go back to normal is so understandable, but so difficult to manage. Next slide. So Dr. Michael Osterholm, who was our state epidemiologist, continues to be a very prescient man on a national level. He described COVID like a baseball game. I'd say we're in inning 3, maybe getting to inning 4. But what we have to understand is, just like in real baseball, 1 inning can take an hour, 4 innings can take a half an hour. It's all about what happens. And I worry desperately that the next inning could come quickly. It could be long inning, longer than the ones we've had. And if you are like me, I always got so bored by the 3rd inning of baseball, and 4 to 7 seemed interminable. Next slide. As professionals, we don't know, and we won't know. And this is really hard for us. We haven't trained to know, to show, to guide, because young children look to their adults to know and to reassure. So many of us practice with a lot of knowing. We say, this is what children need to know. This is how children manage. Here's how we do it. And we are faced with this uncertainty of, really, I don't know. Yet we share the same vulnerabilities and fears as everyone. So when we say, I don't know, part of what we can share is, I'm as frightened as you, or I'm as uncertain as you, but we still want to be helpful. So perhaps we need to switch from knowing to, first of all, tolerating uncertainty, to really join. And I think a lot of clinicians are saying this to each other. We find ourselves sharing more during this time. We're more open to say, I know what you mean, or this is how I managed, or these are the things I was feeling. And I think that happens when the threat is a communal one rather than an individual one. But we also have to become creative about what we're actually doing to help children and families. Next slide. We need to learn how to help kids be compliant with COVID safety. Next slide. Masks are an interesting example of how a community response interacts with an individual and a family response. And then we see some of the challenges. Kids are willing to wear masks because adults help them understand danger and they feel protected. I'm actually amazed at how well most kids are doing with masks. I'm stunned that preschoolers are actually tolerating the masks at times. Kids who don't wear masks are often because their parents don't believe it's important. And this is really hard for kids when parents have such a divergent belief from what the community belief is. Because then they don't know who to believe, who is telling them the right. But mostly it's hard for us because we have to protect ourselves and care for them. So this feels to me a huge community crisis that we're all sharing. What do we do when someone doesn't believe in COVID and yet I have to protect myself? Our stance with children has been, if you want to come to our setting, you have to wear a mask, or you have to wear a mask at these times. We want to be understanding that this is hard, but we also want to protect ourselves. But there's a third category, children who don't understand or they don't feel we care. So these are children with the neuropsychological vulnerabilities, or some of our most challenged children who become oppositional because it's just what they know to do. And these are the children we really have to help them understand and feel cared for. And so any of you in a group setting, that's going to be your work. How do you help these children understand about COVID and also feel cared for? In one of my day treatment programs, they brought the kids back and we worked a lot about, how we would talk to them about COVID. And the staff came in and they were talking to the 4 kids and discovered that they kept using COVID and the kids didn't understand what they were talking about. So when they slowed down and said, what do you call it? They agreed on this common word, the virus, and that worked. Next slide. How will group experiences work? Can they stay open? Will our efforts to stay open require a period of open, closed, open? Next slide. Oh, so I didn't go in here. I put a slide just this morning. There was a study in the Washington Post, and it's a study out of Mass General in Boston. And it found that actually young children are probably carriers of the virus much more than we thought. So that hope we had back in May has not been realized. They don't seem as susceptible to getting the virus, which is good news, but they do seem to carry the virus. So it just reinforces, again, there's so much we don't know. And we're just going to have to, stay open to the information as it comes. So let's think about the challenges ahead and think about some things that we can use. Well, before we go to challenges ahead, let me check. Do we have any questions?
We do not at this time, Anne.
Okay.
I don't see any right now.
Okay, as Lynn said, I love questions. So please keep them coming in. So we're talking about what we know. We're talking about some of the challenges that we can anticipate. Now let's go to our ideas. This is really the important part of the webinar. What can we do to help children? This is where we want to put our heads. Next slide. All right. The first thing we want to think about is more than ever. And I compliment the Thrive communities because you've been doing this for a long time. But more than ever, we need to have family, schools, and mental health support working together. So family, schools, community supports, mental health supports, all working on the same team. We have to, because COVID prevents us from seeking out help in multiple communities. It prevents us from having restorative experiences. Even if your schools are going to open this fall, the hybrid model is going to be incredibly stressful. So we're all working together, and we're all working for a single goal, which is helping children survive and thrive during this pandemic. Now, I want to make that really clear. Remember my first slide, blaming on COVID? Everything becomes about managing COVID. So even if a child is having oppositional problems, we want to contextualize it as COVID, because change happens in the moment. It doesn't happen by going into the past. It happens right now. So in some weird way, COVID gives us a respite or a pause for other crises, and it allows us to mobilize our support. Next slide. Families, schools, and mental health. So let's talk about them each. I see that some things didn't get cleaned out. So with families, we want to work on helping families stay connected, right? And even if the family can only connect to us, that's a significant progress. We don't want our families to get too isolated, because isolation causes implosion. Isolation causes that second rule. You can be mad during COVID, but you can't stay mad. When you're too isolated, you wear and tear on each other. So even if the connected is only a phone call a couple of times a week to a provider outside, that's helpful. We want to support insightful parenting. All right, we'll talk more about that. We want to help them to use support. Again, isolation can sometimes make your social needs dissipate. I'm having a hard time going to socially distant connections with friends, even though I know it feels better if I do it. But the problem is that my social energy has really depleted as COVID has taken a toll. So we have to help families to use support, to remember that support works. I already said blame it on COVID. And the last one is we have to help parents, families stay flexible. Remember Jack be nimble, Jack be quick? I think that's going to be our code for this fall. Families be nimble, families be quick to move out of bad states into better states. Schools and community learning, we need to recognize that engaging is more important than content. Last spring, everybody went to content on Zoom and it was a bust. You can't do the curriculum that worked in a classroom over a Zoom call. So we really got to think about how schools are going to engage individual students. We got to enrich them to their own experiences. Every place is a classroom. So instead of thinking all teaching comes from me, I have to be the facilitator and help families be teachers, help siblings be teachers. It's got to be experiential. We have to help children be active learners, and we have to support how different children learn. Any of you in education, this is your challenge this winter and fall. You have to know individual children's learning styles, not just the students on IEPs or the students identified as difficult, but all children, because otherwise they're not going to be able to learn. In school, so much of what makes learning enjoyable is the peer group. And many children will borrow from their peers as secondary ways of learning, and they're not going to have that now. Mental health, we're coming into their homes. Zoom, I'm right in their homes, just as they're in mine. So we have to really develop a strong sense of respect. We have to support community to support its members. So I'm thinking a lot about applied mental health. Not everybody needs a therapist, but everybody needs therapeutic support. So many of our community partners need us more as consultants than the direct providers of service. We want to really explain how children work, and we want to recognize parent stress. Next slide. This is an advice for educators, and I'll do this very quickly, but if you're an educator, I hope you'll look at this slide again. I think more than the 3 R's, or whatever we call educational curriculum, we need to consider the 3 E's. And the 3 E's are engage, enrich, and entertain, right? Those are going to be critical if children are going to make it this year and learn. They have to feel engaged with their educators, but also engaged as active learners. They have to feel enriched. They have to be able to take an idea and research, explore, expand what they know. In some ways, I would rather kids take one idea and really learn a lot about everything than continue to do this broad-based workbook style learning that we have gotten into. I know one family that had a older, he wasn't a preschooler, he was a 8-year-old, and he wanted a pool, and mom told him to research pools. And when I got on the call with him, he knew so much about the geography of pools, the architecture of pools, the chemistry of pools, how much water had to be mixed with chemicals, the cost of pools, and his final discovery was that there are no pools to be had in the entire United States. Every pool company has sold out. This was a great enriching lesson, because by the time he discovered there were no pools, he wasn't mad at his parents anymore. He was totally resigned to the fact that because of COVID, this is what was happening. He was actually interested in that. The third is entertain, and I mentioned this already. So much of school, whether it's preschool, daycare, elementary school, works because peers entertain each other's. And we have to engage students' brains so that learning stays enlivened and valued. You know, when I say entertain, I don't mean that teachers have to become clowns or actors, but we do have to find ways to keep children's brains from being bored. And there's nothing as boring as repetitive learning with no context that makes it interesting. Next slide. All right, so let's talk about our own mental health work. This is really what we want to get into, because I'm assuming that most people on this call are either providers or partner with providers or in that group that I'm very respectfully calling applied mental health staff. So when I define mental health, I say that mental health is about learning. Good mental health is the ability to learn and adapt. Very simple. Mental distress is the inability to learn quick enough to manage the demands of a new situation, right? So when we think of regulation, a very core of mental health, we talk about it as the ability to learn to stay in balance in the face of change, stimulation, and big feelings, right? Big feelings. When we talk about dysregulation or mental struggles with regulation, we talk about the inability to stay in balance when there's change or stimulation or big feelings. All right? So we want to keep it really simple. And we want to think about what is our mental health work now? It's really to help children and families learn to adapt to COVID and be able to manage. So listening to and encouraging families to recognize their ways to manage, and I changed it, but I didn't send Jan the new PowerPoint, so I apologize. We also want to listen to and encourage children to recognize their ways to manage. The second is to provide guidance to parents about how children feel, think, relate, and act, so parents can stay kind and responsive. And the third is to observe patterns that cause stress and help parents realize the cost to themselves and their kids. So let's talk about how we do that. And again, if you have examples or ideas or illustrations of these, please share them. Next slide. So the first is, so much of COVID coping is it about adapting, and children probably adapt better than their adults. And that's the nature of flexibility, especially when children don't feel endangered. No different. Children fall better than adults because their bodies can stay flexible to change. So we want to recognize that. We want to think about helping parents know what is working and then tell their children what is working and talk about what is not. I added something here that isn't on this slide, so it will be in the corrected version. I use the anachronism DAM, D-A-M. I particularly like it because with some kids, when I say it, they get quite nervous and they look shocked, and I can say, oh no, not that damn. I never say that. But DAM is D-A-M. And I think it really works for helping us know what happens with anxiety. Anxiety is always triggered by danger. Now, the danger can be outside, the danger can be inside. Right now, we have the danger of COVID, a minuscule virus that none of us can even see, but we imagine it every place. But we also have the danger inside, which is our own reactions to COVID and what COVID does to us. So there's a lot of danger. Anxiety is the physiological response to danger, right? So when there's danger, our bodies say, gear up, get ready to manage. Anxiety is a cousin to fear. Fear is a response to imminent danger. Anxiety is a response to anticipated or remembered danger. Now, anxiety is also energy, right? Anyone who's felt anxiety knows there's an energy to it, not a positive energy sometimes, right? So when we think of DAM, the M and the model is managing or mastery. So what you have to do with anxiety is do something. You have to do something. Now, the do something doesn't mean solve COVID, but it does mean move. So some of us are cleaning our houses. Some of us are taking on projects. Some of us are doing jigsaw puzzles, right? Children need help to do something. So that's part of why COVID is so hard, because we're all hunkered down and children feel really bored. But we really have to help them figure out what the mastery is. Now, the other thing that we know is that during this time, this was a study that I added onto Tuesday's slides, there was a study about children's sleep. And surprisingly, it found that most preschoolers are sleeping better during COVID. It attributed it to a couple of things. One was that they're kind of on holiday time. So they're not waking up when they have to. They're waking up when their body is ready to wake up. So the circadian rhythms are more natural. The second thing the authors posited was that children may be getting more appropriate time with their parents at the end of the day. Because everyone's home, transportation time is down, parents have a little more energy to help their children go to bed. Right? So we want to recognize that some of knowing our children's needs is looking at where they're adapting. The third thing we want to think about that we want to tell children is that talking about your worries really works. And being able to think about how you talk about your worry in the family is very effective. Fourth point is that screen time, which everybody's terribly worried about, of course, is probably not so bad, especially during COVID. I'll add a link in my revised slides. And there's an article in the New York Times where an author who wrote a lot about the dangers of screen actually is saying, I'm going to retract my comments. And she makes some very good advice about using screens with children. So let me share it here a little bit. Do you remember Dora the Explorer? When Dora the Explorer first came on PBS, it was significant because it wasn't like Sesame Street or Mr. Rogers, which was adults animating the time. It was actually a cartoon. But the producers recognized that for a cartoon to work with young children, it also had to engage them. So that's why Dora was always asking people questions. And we were always looking for what Stryker was doing wrong. It was keeping children engaged. So this author on screen time advises us to stay connected with our children. So that if they're going to be watching screens, sit down with them, interrupt their zoned in state and talk about what they're looking at. Help them share it with you. The second thing the author recommended is focus on feelings. How did that character feel? What do you think they're feeling? What did Bob the Builder feel when everything was so hard? Because feelings engages the brain. And the third thing that the author suggested was not to get into an all or nothing state where you're taking away screen time for long periods of time, but to really negotiate and repair overuse, because our children are needing screens. They need screens because they don't have a lot else to do, and we need them to need screens. Be honest. A lot of people, to get their work done, need to plop their kids in front of screens for a while. So again, we want to adapt and learn how to use it helpfully. The most important thing here, again, we want to reemphasize is that when adults are distressed, their children follow their lead. So really help parents recognize how they influence their children. I can't tell you the number of times I get parents who call and they have a list of their children's sins, the things that children are doing wrong, and they have absolutely no insight then the parent's mood and attitude is influencing the child. And the work is saying, how are you doing right now? And then you hear how stressed the parent is, and then you have a perfect correlation to why the child is struggling. Next slide. All right, providing guidance about how children think, feel, relate, so parents can stay kind and responsive. All children are not the same. So when we work in mental health and applied mental health, remember children's temperamental vulnerabilities. Remember temperament. Your mellow yellow 4-year-old is going to manage very differently than your hyperactive 4-year-old. Your anxious, vigilant child is going to have a very different response from your, easygoing, extroverted child. Your extroverted child is going to have a harder time than your introverted child. So really help parents think about who your child is. I always say that the challenge of parenting is parenting the child you got, not the child you imagined you got or you wanted. So really think about that. Children have feelings and need help naming them so they don't get overwhelmed. That old early childhood mantra, name it and tame it, is more true than ever. We have to keep naming it, and we have to keep talking about it. One family said that they told their children about COVID. They have 2 preschoolers and a 6-year-old. They talked about COVID back in March, and they decided not to make a big deal of it. And all their children are struggling because the parents are struggling. And so my first advice was, come on, let's blame it on COVID. Let's talk about it. Tantrums and other expressions of big feelings require adult help, not harshness. Now you can see why I love that you can be mad at COVID, but you can't stay mad. If families are getting harsh to their children during COVID, their children will be affected. COVID in and of itself is not a trauma. What will be traumatic for children is if the parents that they count on turn on them. That will be a trauma. Because COVID makes children distressed, but it also often comes out in behaviors, children really need adults who can make sense of this. Children need adults to help them not blame themselves. You know, I had one child who's gone back to bedwetting, and the parents were getting all strict and restrictive. And as soon as we could shift it and say, this is about worry about COVID, and we can worry about COVID during the day, so your pee can stay in at night, he was much more able to handle nighttime enuresis. Nighttime enuresis is never on purpose, but it's stress. It's stress that can't get metabolized during the day. Because children absorb their adult stress, they blame themselves when adults don't help. When children absorb their adult stress, they blame themselves when adults don't explain. So I have a couple of children who have actively talked about their mom being mad at them all the time. And when we corrected it to their mom being really stressed, you could just see their tension relax. Children will be scared and worried too. Next slide. All right, let me pause and just see questions.
Yes, we do have a couple questions.
Okay, let's do them.
In an early childhood classroom, can you talk about teachers and assistants wearing masks, excuse me, when children under 5 aren't required to? I believe we need to wear masks to teach kids about the safety of them.
I think you're absolutely right. I did a talk yesterday, and I was being taped in an auditorium, and I kept my mask on for the first few minutes because I think we all need to normalize masks. I also think we need to wear masks to convey to children, this is what we need to do. Not just this is hard or COVID is bad, but you know, it's that whole new normal. When pictures first came out, and I know we don't want China's air quality, but when COVID first happened, there were pictures of Asian countries where people wear masks quite commonly when they go out. And so you could see how masks had become integrated, all right? So I think we need to do that, as hard as the masks are. Now, we've all talked a lot about children can't see our face, they can't see our smiles. We realize how much nonverbal communication is restricted by the mask. So we're all using prosody more, we're using our hands more, we're using our eyes more, right? We want to find ways to really use the tone of our voices more so children can see. I know there are some masks with plastic. I've understood that they are also quite painful to the adults who wear them because the plastic gets irritated to our skin. I heard one person who tried to put Vaseline on the plastic. Oh, we're all trying so hard. Now, I think the second part of your question is, can we show children that wearing masks is okay so they can wear masks? And this is a question that I believe will become more prominent in the next couple of weeks, especially based on this new finding that children may be carrying COVID, not showing symptoms, but passing it on. They're not showing symptoms is because of something about the level of receptors that they don't have. As we get older, we apparently have more receptors. So I think your question is very prescient. how do we make mask wearing something that is not aversive and is hard, but because we're all doing it, we can do it. It kind of reminds me of switching to winter. Remember how hard it is to get kids to take off their shorts or to start wearing boots or to put their hats and gloves on? You know, like we don't want to do it because we don't think it matters, and yet we have to. So I think that's what we have to think about.
And I have another question. How can preschools, daycare providers best help support their families' parents' mental health, not just the children's mental health?
Well, I think that's why I put that slide, that we really want to think. The first thing is thinking about families. You know, I am primarily an individual therapist. I see individual children. I always see parents, but my focus has been on the child. And since COVID, everything is about families. The unit is the family because we're not away from our families. The families are helping us function. So I think those of you in daycare are providing support for the children and their families. Number one, I think any story that you can tell the parent about how the child is responding, so that we think about this slide that's up now. When we think of children's development, we're always thinking about relating, feeling, thinking, and acting. We want to keep all four domains in our mind. We don't want to just think about this child behaved badly today. We want to say this child was feeling really worried today. And I think she was worried about you because she heard that maybe you weren't feeling well this morning. And I think that made her act in a way that told us how stressed she was. And luckily, she was able to use the staff to focus on Legos and feel better. Do you see what I just did? I went totally around the wheel. And that kind of guidance is invaluable because it teaches the parent not just to hear bad behavior, but to hear what the child is worried about and how the child's feelings are impacting behavior and how the child can or cannot use help. That's number one. Number two is we cannot take on everybody's mental health. But I think the advantage of COVID is that we can say everybody's anxious and everybody's a little depressed. So we can normalize some feelings. Mental illness can feel exacerbated when the person feels isolated or shamed. So saying to parents, I think everyone's having a hard time normalizing it, and then encouraging support and help. I'm so glad for telehealth, because it's so much easier for us to get help now. You don't even have to go anyplace. And having good resources. You have Essentia Health in your community. You have several good health systems throughout the North area. So learn about your resources and be able to offer them to families as a way that says we're all struggling. And this is a normal response to struggling. Get support. The third thing I think we really want to do is encourage the clinicians in your community to be consultants to daycares. This is confusing. And the more, again, remember that partnership slide? The more that clinicians can partner with daycare centers so that there's a working relationship. So when a child is confusing to you, you've got another mind to come in and say, let's think about what we can do. You know, when, I don't know if you can see me, but when you put your hand right in front of your face, we talk about you can't see the forest for the trees. And it's same as daycare. You can't see the child amidst all that's going on. But a consultant can come in and help you see more clearly. And that's invaluable because we all want to be supportive to families. Those are my three thoughts. Now, I could go on a lot, but let me go to the next slide and we'll keep going. When we think of children who are stressed, all roads do lead back to relating, which is why parents cannot stay mad at their kids, but it's also why we don't want to stay mad at the kid. So the other thing I'd say to the child care centers is you cannot stay mad at kids. You cannot. You have to bring them to you. You have to bring them. You can't physically bring them to you. You can't have them snuggling on your lap, but you have to bring them to you in your mind and say, let's figure out what's making it so hard. We can do this. We can figure out why it's hard for you right now. And that act is an incredible support to parents in the community, and especially parents with mental health stressors, because saying to the parent, your child is acting like a brat at school, your child is hitting other children, your child is knocking over toys, your child is refusing to eat, is just going to make parents more stressed, not less. So let's all work together. And let's remember that especially for young children, we are the mediators of the feeling, thinking, and acting functions. And when we insert ourselves, let's figure out what we can do so that you can feel better. That's your critical sentence. Let's figure out what we can do so that you can feel better at daycare. That's what we want to remember. Next slide. All right. Oh, I said can't see the forest with the trees. I forgot I put that there. So the third role that we have is watching the interactive parents that can make or break family coping. So when we think about stress, I added a slide, but it didn't come in. I'll get it to you. I keep saying that. Just our beautiful stress system. So if you remember our stress system, it's in our brain, but its function is to serve our body. So the idea of stress is that it kicks up when our body needs extra help, and it recedes when the stress is mastered. Now, we know a couple of things about our stress system. Oh, there it is. Oh, go ahead, next slide, and I'll come back. Look I did put it in. All right, the amazing stress system. So this is what it looks like, but it's within our brains for our body. When stress is tolerable, we can survive and thrive. In fact, stress is necessary, right, to get us going. When stress becomes toxic, which is too much for too long with too little help, then the body and mind react. So a lot of times when children are misbehaving in your setting, it's not because they don't know the rules. It's not because they're choosing to be bad. It's because they're stressed. And for them, the stress is toxic. Now, sometimes we can't do anything about too much or for too long. COVID is too much, and it's gone on for too long. And it looks like it's going to keep going. But we can do something about the too little help. And that's why I want us to think about relationships. Here's two things we know about stress. Stress in the present plus stress from the past is called toxic accumulation. So if the child or the family has had really hard times in the past, and then they have COVID, those accumulate. So they are at risk for this being a trauma, right? It's the accumulation that causes them to be powerful. But the second thing we need to remember is that stress in the present that is managed causes past memories of stress to be softened. So managing COVID could actually be a cure for some of life's hardships in the past. We could come out of COVID feeling better. Jan, would you go back a slide? All right, so let me tell you, so that's what we mean by patterns. Patterns are the way we've learned to cope with stress that are habituated or forced because this is what we need to do. Right? So many families have maladaptive patterns, but they don't see them because they feel familiar. They feel like this is just how we do it. My kid does something and I scream at him. It's just how we do it. Because we're right in the moment, we have an opportunity to show parents that they can seize that moment. They can do something different. They can say, because of COVID, your yelling is more impactful because your child doesn't have any other adults to mediate that. So could we work on that? Now, I'm going to suggest that we be demanding during COVID, that we don't just offer people opportunity to change a pattern, but we demand that they do, always in very kind ways, because they want to survive COVID too. And some of these maladaptive patterns where we talk and talk and talk about them in community practice and hope they'll change, COVID has the motivation and the demand to force learning. One of the things about anxiety is that if we can use it to new learning, it can actually happen. Next, 2 slides. Okay, Jill Biden the other night had a very moving sentence in her talk. How do you make a broken family whole? And I just resonated because we think about this all the time. Next slide. So when we think about making a broken family whole, we have to think about why they're broken. In addition to their earlier traumas, we know that COVID plus restricted village plus coming winter is going to mean a ton of stress ahead. We know COVID plus restricted village plus winter plus illness and possible deaths are going to be beyond hard. We know that more people are going to get COVID, and we know that that's going to put stress on. We know that broken people, broken families, broken relationships need so much more than Zoom calls, but we don't have a lot to offer. Especially if this virus gets worse, we're going to all shelter again. Our in-home and crisis services are going to get restricted. We're all going to be stuck again. So what do? I think what we want to think about is that we have our limitations, but we also have possibilities. And the possibilities are 2. We can share our minds, right? That's all we have during COVID. But it really works on a COVID call to say, I was really thinking of you this week. I knew you were going to the doctor, and I see that you look okay. I'm so glad. Or, I wish I could be there with you. If we were in my office, I would hand you a box of Kleenex. Or if we were in my office, I could lean over and take your hand. And I can't right now, but we can think about what that feels like. People are using their minds to get through COVID. The second thing I alluded to earlier with patterns is that focusing on families' intentions and how their intentions fall short is going to get us into reparative work sooner. So when parents say, but I don't intend to put her down, I want to say, I know that's not your intention. So what can you do so that intention comes through? Because the way you said it did put her down. Now, again, I'm underlining, we have to make demands. We really have to make demands during COVID, not because we're unreasonable or we're mean or we're harsh, but because people are hiring us to help them survive COVID. And if we fall back into our Minnesota nice and feel like we can only think what's going wrong and not telling anyone what we see, then we're cheating our families of the help they need. Next slide. All right, so taking care of ourselves. But let me pause. And again, are there questions?
There are not right now. There is discussion around the clear face masks. I will just add that yesterday, the Today Show did have a special on face masks. There is a clear face mask that has passed all the tests. So you may want to go on their website and take a look at that.
Yeah. Absolutely. I had a clear face mask slide before. The problem is, and I hope they will work, but the problem is they also look, it's not a full face, it's just a shield. So while they'll see the part of your smile, they won't see your cheeks, they won't see your chin. So know that every solution has positives and negatives. All right? Every solution is going to have pluses and minuses. You're still going to have to use your voice. You're still going to have to use your body. You're still going to have to use the other nonverbal tools that you have. Don't get fixated on just the face. Let's stay open. Any other thoughts? All right, let me talk about
That's it for now.
Okay, let's talk about taking care of ourselves. So the 3 ways that I want to take care of myself are following, because as I said, this is hard and we're all in the same boat. We're all going to struggle, whether we're mental health providers, medical providers, educators, daycare providers. We are also afraid of COVID. We're also suffering from not knowing. We're also vulnerable to get sick. We're also overwhelmed. So the first thing that always helps me take care of myself is knowledgeable practice. I joke that, some people get massages, but I have to feel like I'm doing a good job. Otherwise, it doesn't help me. All right? I gotta feel like I'm doing my job well. And that's a challenge in COVID. So 4 things to support knowledgeable practice. Keep child development in mind. When in doubt, say, what do most 4-year-olds do? And then think about how this 4-year-old is managing. Keep it in mind. Number 2, always ask what's happening inside. So the parent complains and you say, what do you think is happening inside of your kid? Or you say, what do you think is happening inside of you? What's happening inside? This question is so important because it helps us really get underneath behavior and understand how feeling and thinking and relating needs are fueling behavior. It also helps us understand how the child is disorganized. I used this sentence yesterday in a consultation. A very lovely staff person was really frustrated because the kids were coming back to day treatment and they had forgotten the rules. And he was so frustrated because he felt like the rules were such common sense. And how could they have forgotten the rules? And what we got to were 2 things. One is they were coming back after 5.5 months of not being with us. So of course they had forgotten the rules. Many of the children were living in very different circumstances. But the second thing that came up was that our common sense is evidence of our privilege. Right? I'm not talking about a cultural or racial privilege. I'm talking about developmental privilege. When we can stay organized, when we can stay collected and keep our feelings and thoughts working, that's our privilege. And whether that privilege is historical because we were lucky in our birth families, or whether it's earned because we've worked hard to learn how to stay in balance, that's privilege. So when we work with families, we want to remember they are not as privileged as us. And so asking them what's happening to you allows us to Velcro on that wonderful developmental knowledge and wisdom that we want to offer them. The third is we always want to support both parent and child. Right? We do not want to take sides. Even if you're so angry at one or the other, you've got to think of the relationship, because it's the relationship that's going to solve the problem. And the fourth is to recognize resilience. More and more, when I'm on calls with families, I'm looking for what's working. I'm reframing things about why that worked. We have to promote resilience. Next slide. The second thing is to take connected to your own village. So taking care of ourselves. Do talks like this, but more importantly, find the people on this talk that you know and suggest that you get together by Zoom every couple of weeks and talk about how you're doing. Seek support when you feel stuck. This is a time where no matter how many years of practice you've had, having a consultant is still a good idea because none of us know what to do. So we're all looking for that outside voice that help us keep our balance. Ask what's happening inside for you too. So if you find yourself frustrated, before you blame the family, sit back and say, what's happening to me? What's going on for me? Because probably there's a resonance there. Third is knowing doesn't mean not feeling. This is such an important part of clinical practice. All of us went into this work with the thought that if I just knew it, no bad things would happen. And unfortunately, it doesn't work that way. So don't get tripped up by your knowing function and lose your feeling function. Feelings are going to guide you and get you to better practice. And listen to your own good advice. I can't believe how many people I'm telling that they should exercise or they should move more. And I'm often sitting in a chair for 12 hours a day. Not good. We give good advice, hear our good advice, and act on it. Next slide. And finally, you can guess I would come to this is reflective practice. Not just seeking consultation, but find a group that's willing to not solve problems, but hold feelings. Reflective practice is that ability to get together and someone says, what's happening? And there's space for all of us to quietly, carefully, slowly, insightfully discover what it's like that week. Reflective practice for me is what keeps me going. It's like my health club visit. It keeps me engaged with my own process. I can receive much needed support. I can shed that sense of solutions. There are no solutions. There's only figuring out what worked today. And it really reminds us of the power of being heard and validated. You know, so often in reflective practice, we get into like a consultation mindset and we think we have to solve it, when actually all we have to do is share it, because being heard really frees up to solve our own problems. Next slide. All right, so we have about 14 minutes, so I hope you have questions or thoughts or examples.
I don't have any questions in the chat right now, Anne.
Oh my
But
goodness.
hopefully, yes, I know. We had so many the other night. I'm surprised we don't
we'll
have
make
more.
them competitive. We'll say the other group was better than you. Not really, not really. Well, let's talk about some of the questions that I remember from the other night. You know, one of the questions was, this is so hard, and how do we promote resilience? And I think what we're seeing is this is so hard. I mean, we can't say it enough. I was joking with someone. In March, we said, we can all do this. And now in August, we're saying, oh, this is so hard. And I think there's truth to that dilemma. We really did kind of spend our resources through the summer, and we're coming into the fall pretty depleted. So what resilience is the ability to keep growing and learning. So it's not to do it right, but it's to keep trying. And I'm seeing families find some new ways of doing. I know one family that spent a lot of time this spring doing games and puzzles, a lot of time this summer doing, you know, just their usual outdoor activity. And the other day, the mom went and bought a basketball, one of these portable basketball hoops, you know, these very heavy plastic ones. And I said to her, but none of your kids play basketball. And she said, I know, but I think this fall they should learn. And we laughed. I don't know if she kept it or returned it, but I think families are thinking ahead. What else can we learn? All right, what else can we learn? For those of you who are facing school with school-age children, we can't go back into memory and recall what it was like in March and April. Oh, by May, all we wanted to do was shut it down. I think all the teachers wanted to do is shut it down. So as we go into this fall, we're going to have to go in with, again, not an open mind that it will be better, that's passive, but an active mind that says, let's think of the other ways that we can make this work. Some families are forming learning pods. Maybe that's an option. But I think a lot of families are really thinking about how to reconfigure their space, how to reconfigure their time, how to think about what learning really is. I hope that school districts do not grade children. I hope that we do not keep assessing children the way we used to. I think we can really, I hope we can use this year to create experiential learning and encourage families to get into the idea of experiential learning, which will be easier for some than others. But that's the thing about we got to keep learning. We got to keep learning. What we learned in the spring is not enough. We don't know how we'll learn, but we got to keep learning. Did I spark any other questions?
I don't see any other questions right
Well,
now.
Lynn or Jan, do you have any questions that you're thinking about?
Uh,
Do
well,
you
I was
think?
trying to, I was reflecting on the other night, and
Mhm.
you went into, and you did today too, about the tantrums and
Yeah.
about sleep, and I found both of those extremely helpful.
Hmm.
The whole idea of the sleep issue, understanding that children might be sleeping longer now or whatever, it just seemed more relaxed sleep. And I thought that was really helpful to understand why. And
Yes.
so I don't know if you want to talk a little bit more about that. You mentioned it,
Well,
but I think
again,
talk even more.
I think this is about helping parents really pay attention to their children. I mean, one of the, I hate to say benefits of COVID, because I don't know that it's a benefit, anything's a benefit of COVID, but one of the, the, um, the potential outcomes of COVID that have positive effect could be that families have to spend more time with their children. And let's be honest, we've been living a crazy life. We've all been running and running and running. Parents are both working. The good parental behavior is getting your kids involved in many, many activities. We have families with preschoolers who are doing sports and arts and dance and, just activities all over the place, play groups. And COVID has, just brought us back to practically Little House on the Prairie. So I think as supporters and providers, our number one role is to help families know their kids. You know that old phrase? It was a song from my childhood. To know her is to love her. I won't try and sing it, but I bet some of you can hum along. To know her is to love her. And I want us to remember that with families. To know your child is to be able to love them better. To get estranged from your child happens when you're making demands and it feels like your child is thwarting you. That's actually the opposite of reflection, and that's reaction. When children are tantruming, they're reacting to a feeling that the world is hard. When parents can be comforting, children can become reflective too and start to think about what's happening.
I do have a couple questions. One is, speaking of sleep, any suggestions for preparing kiddos to get back on an early schedule when they return to school?
Well, if your district is smart, they will delay start times because all the research has been telling us for years that we're waking kids up too soon. And even for those children who seem like early risers, that time between waking and then actually getting into a productive brain is a lot slower than we've allowed. So that's my first thought. If your district is going back, and you do have to wake kids up, you should be practicing and urging parents to start practicing now. Darkness is on our side. It's really hard to correct circadian rhythms in the end of June. But the end of August, you got a little support from the sun going down. So you want to talk to your children. The way you change rhythms is you get children to go to sleep earlier so they can wake earlier. So if you're just waking your kid up without going to sleep earlier, you're going to create sleep deprivation. So you want to help the child go to sleep earlier. It can be 5 or 10 minutes a night, but just keep moving that clock back because our bodies feel how much sleep we need. And depending on when we go to sleep, we wake up in the morning. So if your child is going to bed at 9, and he's waking up at 7 and you got to get up at 6, you got to get back to 8 at night. The third thing is make sleep time pleasant. That's one of the study findings. Parents were spending more enjoyable time helping their children learn how to do the wind down to sleep. We think that we finish working and we say, okay, now I'm going to sleep. And in fact, our body, our cortisol has a gradual wind down from about 6 o'clock on. So the more that you can make that wind down time actually wound down, the easier sleep will come. The more that you stay busy in the evening, your child is producing adrenaline to fight the lack of cortisol, and that's why you got that rebound effect. So when we were all coming home from work at 5 or 6 and having to cook dinner and get the laundry in and take care of homework and put our kids to bed, we were really messing ourselves up. But maybe we have an opportunity to change that.
Okay, here's another question. How do you keep the focus on learning when people can be so reactive during this time?
Good question. I think we do it by saying mental health is about learning. And when people get reactive, we say, what is it that your brain needs to learn right now? You're really having a hard time. What do you want to learn? So the parent is screaming about how bad her kids are. And I say, I'm really hearing how stressed everyone is. What do you want to learn? And what do you want your children to learn? Now, as soon as you introduce that idea of learning, you've interrupted the parents' both franticness, but also their kind of passivity. You know, when they call us up and say, make my child better, sometimes I feel like, you know, I want to say, I'm not a garage where you deliver your car and I fix it, right? This is a person. So if you want your child to be better, let me commiserate with you that this is a really hard time and lots of kids are having a hard time. And let me know, what do you want your child to learn? And then tell me, what do you need to learn so that you can help your child? Now, could you hear how my voice slowed down? That's what we want to do. When we're faced with reactivity, we want to go to reflection. Those are our 2 R's. Reactivity is negative. It's necessary in crises. We all do it, but over the long haul, it doesn't get us to learning. It gets us to surviving. But reflection is what gets us to learning, and that's how we thrive. So we want to survive, but we also want to thrive. However long this lasts, we want to come out of it better people. We want to come out of it feeling like we did it. We want to come out feeling a collective sigh of relief, but also a collective strength that we managed one of the hardest things that any of us will ever have to do.
Okay, I have another one that says naming and taming. I work at a nature-based preschool, and as we as a staff are making a conscious effort to discuss emotions with our students. Every day we'll focus on a different emotion. In this time of stress, is one emotion more important than the other to focus on?
Okay, yes, absolutely. So in the hierarchy of emotions, we have fear and its cousin anxiety. Those are your baselines. And then we have the emotions of joy, which are happiness, excitement, surprise. And we have the emotions of pain, which are hurt and sadness. Now, anger is a funny emotion because anger is, it's often a painful emotion, but it's the only emotion where we say, I'm angry at you. We don't say I'm happy at you or I'm sad at you. But anger always is that at you, because anger always has a tail. So when you talk about anger, always talk about its partner. So sometimes I'm angry because I'm sad, or I'm angry because I'm worried, or I'm angry because I'm hurt. So teach children that anger is always a compound emotion. Disappointment is a lovely emotion because that's a little bit sad and a little bit mad, right? And they have to go together. Shame is a tricky emotion, shame and guilt, because those are social emotions, as is pride and arrogance. Those are social emotions. So those are emotions that are important, but they really have to do not just with me, but how I relate to you. So it's a me and you emotion. During this time of COVID, I would focus on 3 things. I would focus on fear and anxiety a lot in every time, so that you clean that one up. You name it and tame it, because it goes away when we feel connected. And then I would focus on the hard emotions, because COVID is hard, and we're all trying to work on our hard emotions so they don't get in our way. And then I'd focus on the positive emotions because they help us be brave enough to learn. And I'd organize them that way, hard and positive emotions, but always pay attention to fear and anxiety because they're the ones that are dominant.
And we're at the end of the time, but there is one question. Could you just give a couple sentences about any thoughts on engaging parents for the first time over telehealth?
Oh, yes. I am amazed at how easy it is. I thought it was going to be so hard. But, you know, the telehealth is something because we are actually so close to each other. You know, our faces are right there. Now, there need to be some prerequisites, like when they meet with you in telehealth, they got to find a space that you can see them and they can see you. So encourage them to set it up. And if they've set it up badly, don't be embarrassed to say, I can't see you. Could we work on this? Because I want to hear you and you want to hear me. All right. Then the second thing is that, you know, you're in their homes. You're sitting right with them. So you be respectful of their space. If their dog comes in, if their cat comes in, you know, you welcome them, but you stay focused. I'm here to help you during this really hard time. Can you tell me how I can help you? So get the contract. Once you have the contract, then people let you in. What doesn't work is if we do telehealth like we do it with our cousins or sisters or friends where we're just chatting and people don't know why we're here. And then they either get dissuaded from using us helpfully or they get confused. So contract, contract, contract. This is what I hear you're needing. What do you need to know about me? Good. Let's work together. What do you think? Okay, we have a deal. But use it. It's really interesting. We see each other. Right now I'm looking at Lynn and I can tell that her computer is on her desk. You can see that my computer is right by my face. So get people to come forward. And I lean, I go in and I say, that's an interesting question. And sometimes I go back and I say, ooh, let me think about this. Use your bodies, use everything you can. Thank you. This is hard. It's also interesting. Stay steady, stay safe, find balance. We can do it.